You got questions and I've got answers. In today's video, I'm answering EMDR related questions from Reddit. If you have a question of your own that you'd like answered, put it in the comments. Hi there, my name is Ashley Phillips. I'm a practicing trauma therapist and the founder of the Kelowna EMDR Clinic. I discuss topics related to trauma, private practice, and my favorite therapy, EMDR. If these subjects are of interest to you, I invite you to subscribe to the channel. It costs you nothing and it makes it easier for others to find this information. Okay, let's get into it. The first question is about staying focused while reprocessing. The person says they've been diagnosed with complex PTSD, depression, and anxiety, and there are some childhood-related issues that were triggered by a more recent experiences like a painful breakup. They decided to tackle it through an EMDR intensive, which can be a great way to get results in a much shorter period of time. I actually did a whole video on EMDR intensive, so if you're curious to find out more, I'll put the link in the description below. So the person says, I had a hard time getting into it and was getting so easily distracted. I know people say let your mind wander, but a lot of thoughts were random and had nothing to do with what I'm trying to work through. After my session, I didn't feel any dramatic reaction like a lot of people talk about. I wasn't tired like I thought I would be and didn't have much of an emotional release, and it makes me worry that I'm not doing it right and that the sessions aren't working for me. If anyone has any advice or tips on how to stay focused and in the emotions that I'm trying to work through, please let me know. So first off, I tell my clients all the time, you cannot fail EMDR, so you don't have to worry about doing it right. And there's a few reasons why your mind might be wandering during reprocessing. Dissociation can be part of it because the memory is outside your window of tolerance. And it's not a bad thing. It's part of the therapist's job is to titrate that memory for you. It can also be part of associations to other memories, making your mind wander. Sometimes it doesn't make sense to us in the moment, but perhaps it will become more clear as time goes on. Ultimately, your job is to tell the therapist what comes up, and that therapist uses that information to direct the process. And if your mind is wandering and you're struggling to stay in the emotions, say so to your therapist so they can adjust. One important thing I tell my clients all the time is not to tell your therapist that you're better than you actually are. This will actually inhibit the process. What stood out for me in the question is that the EMDR intensive was only 3 hours with 2 hours of reprocessing. And that's on the short side. In my practice, I've noticed people have much more profound results after full day intensives where we were doing about 6 hours of reprocessing. So you just might need more time in the chair. One more thing I would add here is that the person is expecting also like some dramatic results. What I find is that for some people, they do have that. And for others, it takes time for like the earth to settle and that they're noticing more of those profound results in time, in days or the weeks after. So to sum it up, as a client, you don't have to worry about doing EMDR wrong. Just be honest and be transparent with your therapist about what's coming up for you. And if your mind is wandering, just say so. Okay, the next question is about dealing with intense emotions. The person is new to EMDR and they like their therapist and feel safe, and that's so important. They've done 2 EMDR sessions and they're saying, at my last EMDR appointment, we worked on a memory that surprised me with its depth of emotion. It was intense. My main surprising and strong emotion was anger when I only expected fear and sadness. Our session ran out of time and I had to pack it all away to finish at our next appointment. Meanwhile, I cannot seem to function without feeling overwhelmed and emotional. I'm so quick to anger and so upset by everything. I feel like I'm losing my mind. What do I do? Is this something I should message my therapist about? I hate it when this happens. I've experienced this personally in my EMDR sessions as a client, and I've had this happen a few times with clients of my own. So yes, do reach out to your therapist right away. I always tell my clients to reach out if they're struggling in between sessions. In fact, in my EMDR training, I was taught that I need to be available for clients after their session, which means that I can't go on a vacation without any reception for a few days after the last last client's session. If my client is struggling emotionally after an EMDR session, especially if we ran out of time during the last session, I try to get them back into my office as quickly as possible to continue reprocessing. And this is a big reason why I advocate and prefer longer sessions for EMDR therapy. You can get a lot more done during an 80-minute session versus a 50-minute one. And EMDR intensives are on a whole nother level. And again, if you want to find out more about EMDR intensives, the link is in the description below. The next question is about when it's time to quit EMDR. I think this is a good question. The person says they've been in EMDR therapy for 2 months and were successful at getting distress down for one of the memories. Now they started working on the second memory and they say, I've had awful EMDR hangover with this one. My distress isn't going down as quickly as we'd like, and I end up feeling like I've been run over by a train for 3 days after, also while battling terrible depression symptoms. My physical health is also starting to suffer because stress causes flare-ups with my POTS and wrecks my appetite. My question is there a point when the harm outweighs the good? And should I ask to switch modalities or treatment? You may notice a bit of a pattern here, but the first thing I recommend you do is talk to your therapist about this. I'm obviously not privy to what is happening in your counseling sessions or what the treatment plan is, but maybe your therapist can try different strategies so that you're not so dysregulated after your sessions, because this intense EMDR hangover really isn't great and if it's really impacting your day-to-day life. What might be going on is that the target is too big that you're working on, and so your therapist will have a variety pack of different tools to titrate this memory, this target, so it's not so intense. And so you might need to kind of chunk it down into smaller bite-sized pieces that your system can tolerate. Another possibility is that you might do better with an EMDR intensive where you're just staying in the process for a longer period of time to really get this thing knocked out. With an EMDR intensive, you want to work with a therapist who specializes in EMDR intensives because the therapist really has to know their stuff. They have to know how to work with anything that can go on during that counseling session. So if your therapist isn't a fit, you may talk to them about a possible referral to a specialist in your area or maybe in your country that works with EMDR intensives and the area of concern of why you're going to therapy. Hopefully this gives you a couple of ideas to try before you give up. Oh, I like this question. Has anyone been able to successfully come off their meds after EMDR? I'm guessing here that implied in this question is that it's about psychiatric medications, which can include antidepressants or anti-anxiety medications, and not something unrelated like medication for heart disease. So what I want to say here is that you should always talk to your doctor before changing dosages or coming off your medications. There may be some undesirable side effects, so make sure you get proper medical advice before making any changes. Broadly speaking, you may be able to lower the dosage or come off your medications after reprocessing traumatic events. The point with EMDR is help resolve the symptoms, and that you might find that you can shift or change your current medications or dose. I know of some people who found it helpful to work with a compounding pharmacist to create lower dosages of their medication specifically for them. Again, talk to your doctor about this as they know your health history and reasons for the medication. And finally, there's a question from someone with complex PTSD who's about to start EMDR therapy, and they're wondering what to expect. The person writes, I'm most curious about things like if it kind of decluttered your brain, if it helps you with finding yourself and building a more stable identity, if it helps your energy levels and motivation, and if it helped you to find your passions and actually enjoy life. There are a lot of things here. EMDR is a trauma therapy and it's very effective at treating trauma-related conditions and associated symptoms. So with PTSD, EMDR will decrease symptoms like intrusive thoughts, nightmares, flashbacks, avoidance, such as like avoiding reminders about it, hyperarousal, and improve your mood, your energy, your concentration, and your sleep, as well as your desire to engage in the world and your interests, and perhaps what you believe about yourself and the world. Essentially, the goal of EMDR is to resolve PTSD and their symptoms. I don't think EMDR will help you find a passion, but it will give you the space and the energy to explore what your interests are and who you are as a person. So it really comes down to the extent to which The things like a cluttered brain, low energy, and lack of motivation are linked to that trauma. Trauma can certainly be the cause of limiting beliefs and issues with self-esteem, which is caused by PTSD. I did a whole video on this a few weeks ago, so if you want to dive in deeper here, check out that video. I'll put the link in the description for you. Okay, that's all the questions for today. If you're curious about EMDR therapy and you're not sure what to watch next, I have a video about the possible side effects of EMDR therapy that I think you'll like. I'll see you over there.